Hey guys, welcome back. That was extraordinary. For some reason, I'm not getting it on the screen here. Are we really back? There we are. Okay, thank you for your patience. I don't know. We have no idea what happened. We had a complete meltdown of all of our technology. It's what we get for being so advanced here. I'm going to pick up where we left off. We were talking about norepinephrine and serotonin and how these various chemicals, particularly in that region, are part of this story.
So we know that, antidepressants that involve serotonin, selective serotonin reuptake inhibitors and norepinephrine and things like that work very well for some people. And I'm sure that as a physician dealing in mental health, you've seen that, right? You've probably seen some people improve after a few weeks with low-dose SSRIs in a very dramatic way. But the research shows that 30% of people just do not respond to traditional antidepressants and talk therapy.
Right.
So it's clear that there's really something else going on here that doesn't just involve the traditional neurotransmitters. And
to be fair, we know a lot about what the antidepressants are doing. We really don't know how they work.
We don't.
We really just don't. Yeah. And so that makes sense that we'd have some mystery around the non-responders.
Exactly.
Because we don't know what the responders are doing either. So non-responders, 30%. And when you say in clinical practice, most of those people are non-responders. Those are the people that are slogged through multiple medication.
Right.
They're adding the Abilifys and all the other stuff to see if there's something, their mood stabilized, see if there's something more going on here than just a depression. I mean, that's sort of the way psychiatrists are taught.
Yeah.
Now, in your recommendation, you would try TMS at that point, right?
Of course,
Yeah.
yes. And actually in other countries like Japan, for instance, TMS is actually recommended as a first-line treatment. So before anyone even tries medication, they would go to this temporary treatment that can have real long-term benefits.
Now, this shouldn't be confused with electric shock therapy, which is a general activation of the brain. It's trying to do the same thing, but it does it by causing a seizure.
Exactly. So electroshock or ECT really induces. It creates this large electrical field that induces a seizure in the brain, and it does this multiple times. It involves anesthesia. There is sometimes temporary or even permanent memory loss. There's confusion. There's cognitive fog. There's really a lot of pretty serious side effects involved with it.
Right.
Whereas TMS, instead of this really large electrical field, it's really just a focused magnetic field without any of those side effects.
Right. I'm a fan. It's expensive, isn't it? It's a little expensive.
It's actually covered by insurance. So,
really?
So
That's a new
depending
thing.
on the insurance company,
You have to have failed other things, though, first, right?
most insurance companies require that you failed anywhere between 1 and 4 antidepressants in the past.
4. That seems so silly.
It does.
And then probably have to go to high doses and stuff.
Exactly. Augmentation trials, things like that.
Let us take a ketamine call, because this is also an interesting area of research that you know something about. And the caller's name is Dylan. Hey, Dylan.
Hi. Yes, I'm 34 years old. I have treatment-resistant depression. I'm just wondering about ketamine being approved by the FDA. So it's covered by insurance, because right now the only places that do it are out of pocket cash, which is not doable for me because I'm on Social Security.
Hold on a little bit. The S-ketamine is available.
Right.
There's a nasal spray that's available. Now, my question is that only after... Hold on a second. Is that only after the infusion therapies that's efficacious, or can you use it as an individual therapy?
So S-ketamine, or Spravato, that's the brand name, which is essentially half of ketamine, was FDA approved in early 2018, and people use it instead of the infusions. So
I have some people using it after the infusions as sort of a maintenance thing. I don't know if that's just some centers are doing that. Probably is.
That may happen, but that's not the indication for it. The indication is, after someone has tried a few different medications, they can do the S-ketamine nasal spray, and they'll come in, I think it's twice a week for about a month, and then they figure out some sort of maintenance schedule. And because it's FDA approved, it's possible to get a single case agreement with insurance to cover it.
Have you tried that, Dylan?
No, right now I'm not seeing any doctors. Right, I've given up on treatment. I'm trying to I want to I mean, it's complicated. I have very limited insurance right now, so
Yeah.
you know.
Is there? I wouldn't
know.
feel comfortable. Dylan, I'm sorry to interrupt you. I wouldn't feel comfortable as a primary care physician prescribing that.
Right.
And yet I often get in these desperate situations with people that don't have insurance. They've tried everything, and I feel like I would like to. Is there any intermediate way to get this medication without having to come in and see a psychiatrist and all that kind of stuff?
Not really. So the only way to get S-ketamine or ketamine infusion therapy is to either go to a dedicated clinic that focuses on this. So, for instance, TMS and Brain Health, we are going to start offering S-ketamine. We have ketamine infusions that we do. But other than that, you know, it's really up to the individual's provider.
So I've seen some striking responses from ketamine. I'm sure you have too.
Yeah.
Right. People that are just resistant as hell. All of a sudden, 3 treatments and they're like markedly better. What's the mechanism they suspect there? Any ideas?
So we don't know that much. We know some things. So we know that, for instance, stress is a very big factor in depression, and we know that
whatever that means.
Right. So, and when we say stress, that can mean, you know, it can mean developmental trauma. It can mean literally the current life stressors like work stress, family stress, things like that. Loss, grief is a very,
So it's all kinds of things. That's why people say stress. Like, what are we talking about? I'm going to bet. I don't know much about the mechanism, but ketamine is a dissociative anesthetic, so it literally disconnects you from more effectively than an opiate, say, from horrible things.
Right.
And I'm wondering if that's somehow helping people regulate their emotions.
Well, I think that's part of it. And what we tend to see is that, you know, very, very low dose ketamine, like so low that you can't even feel it, it doesn't do anything, and there's no therapeutic effect there.
Right.
You have to somehow push into that dissociative state, even a very mild dissociative state, and then the therapeutic effects will start kicking in.
That's very interesting. And I'm worried about it in drug addicts. I've seen some relapses in people that were doing awfully well. And if I know real, honest-to-God drug addiction, if you give anything that is activating that reward setup, watch out.
and that's the issue, because with addiction, obviously, if you peel away the substance abuse, there's almost always a mental health issue there. And so if it's really this depression that's causing the addiction, you know, you have to ultimately make that decision.
How does it? Do you guys do anything with panic attacks?
Not specifically, no.
So panic is not something that TMS helps with. I'm surprised.
We have people who will come in and they have
depression and panic go together a lot. Yeah,
they do. So people will come in with depression and anxiety and panic and OCD and PT. You know, when we see people with these complicated things, then they tend to be better candidates than someone who's, you know, they just have panic attacks. Right. That's really their only symptom.
Yeah. Although, gosh, when people get better from panic attacks, they'll usually look back and go, I think I was depressed.
Right.
So that's me. That was my story. I had panic attacks in college, and I was aware I wasn't happy. When I look back now, I'm like, oh, I was profoundly depressed. Profoundly. Yeah. Let's see. I'm trying to get some calls here that are pertinent to. Why don't we bring in your case, your patient?
Okay.
Is your patient, Elizabeth?
Yeah. So she was a patient at our center. Yes.
Okay. And maybe we should go to break. We'll go to a break and we'll bring Elizabeth in, and then we'll bring Dr. Donovitz in later to talk about hormone therapy and its effect on mood.
Great.
Be right back. They like to say they are test obsessed. Social CBD works closely with their suppliers and multiple third-party labs to ensure you are getting exactly the package that they say you are getting. High-quality CBD with 0.0 THC. And Social CBD wants you to be skeptical. That's why they put a QR and batch code on every pack. The CBD industry is still pretty much the Wild West when it comes to claims and criticisms. The science is catching up with the industry. We will have clinical science soon enough, and there seems to be an overwhelmingly positive response these days to CBD's efficacy. We've all heard the reports, and luckily our good friends at Social CBD are raising the industry testing standards. They like to say they are test obsessed. Social CBD works closely with their suppliers and multiple third-party labs to ensure you are getting exactly the package that they say you are getting. High-quality CBD with 0.0 THC. And Social CBD wants you to be skeptical. That's why they put a QR and batch code on every package. This allows you to check all the test results for your product, not general testing, the product, the specific batch you bought. And while Social CBD broad spectrum products are available in a range of formulations, each of which is clearly described so you can make an informed decision without all that hype and promises that sound too good to be true. To learn more, go to drdrew.com/socialcbd. That is my website, drdrew.com/SOCIALCBD. For a limited time, you can save 20% at checkout with the code Dr. Drew. Now let's get back to the show. I want to welcome Elizabeth to the program. Thanks for being here.
Thanks for having me.
It's a pleasure. So how did you get to the point where you started contemplating TMS?
Well, I was one of those cases that you were talking about, a multiple failure on several different antidepressants.
How long had you been working trying to get some sort of response?
Oh, for decades.
Decades.
Yes.
And I'm imagining, because I've seen lots of cases like that, I'm going to imagine you had periods where like it's kind of working and then it would stop, that kind of thing?
Yes. Yes.
Ugh, how frustrating.
Yes, and before I started TMS, I was on a couple of different, and drugs are always added to the equation, and I was getting better, but I was still depressed. So I had made some progress, but it was very frustrating because I couldn't get all the way there, because I do know what my undepressed brain feels like.
Right. And Ben, I don't know if we can get Ben on camera or not, but I'm going to have him he's sitting by here. And so this idea of complete remission is something that is becoming more, more anticipated, let's say. I mean, I remember back in the early days of the SSRIs where they're like, well, they're feeling better, but now people should look forward to a true remission, sustained resolution of symptoms, right?
Exactly. And with TMS, we're seeing that about 50% of people are getting to that sustained remission.
50% of the recalcitrant cases.
Yes.
And you were lucky enough to be one of those people.
That's correct.
Did it happen fast, or was it after only like weeks of therapy, or how did it work?
It happened fast and then a little bit over the course of the treatment. Because of my experiences with not getting success with antidepressant therapy, the meds, I wasn't expecting very much, but in fact, the first day of treatment, I felt something activate in my brain. I was so excited about it.
That's literally what's happening.
Yes. Yes. Ben showed me a picture of what the brain looks like when it's not receiving blood